Thank you very much.
Yes, sir. Can you see my screen?
Yes, sir. You stop sharing, sir. Just share again.
Yeah, okay. Now seen?
Yes, sir. Just put it on presentation mode. We are good to go.
Okay. Yes. So thank you. So I'm here. Thank you, Dr. Maipal, Dr. Namrata, and Dr. Shashank. And I think everybody knows that diabetes is. I remember one meeting one of the endocrinologists. He told me diabetes means die in bits. I don't agree with that. And as Dr. Shashank said that you can prevent diabetic complication, and that's why in UK they have people with 50 years diabetic and no complication. I think that's what probably we're aiming at. Because once diabetes comes, it is up to the grave. So I think we have to fight with it. And it's like I always tell every patient, it's like an animal. You can tame it. Only one thing I want to convey here is diabetes affects head to foot, right? It affects the small blood vessels of the body, the brain. That's why you get stroke. Heart, you get the heart attack. Eye, you get the diabetic retinopathy. And if control sugar, I think you can live a
So you need to press the arrow.
Okay, what happened? To prevent diabetic blindness, and I call it Jod Se Jod Jalao. So diabetes is now considered the epidemic of the 21st century, and diabetic retinopathy is a major cause of blindness in the worldwide middle-aged population, and the fifth cause of blindness globally. And there are about 415 million diabetics in the world, and Southeast Asia is about 78 million, and then they have said in IDF 2019, as mentioned now, it is 77 million in India itself. And that's where Dr. Shashank Joshi is part of it. And this shows the projection in 2040, it may go to 642 million with diabetes. So prevalence of diabetic retinopathy among diabetics in India, type 2, this is again they published in the old journal, and that time it was 69.2. Now in that they have mentioned 18 to 23%. And newly diagnosed patient with diabetic retinopathy is about 6.5 to 11.73 patient. And according to the International Diabetic Federation, India has 77 million diabetic. In fact, by 2030, according to the estimate, 8.4% of India's adult population will have diabetes. And that means 1.3 billion, about 8.4%. And by 2045, India will have 134.3 million. It's not a proud statistics. And it's an epidemic happening. Every diabetic can be affected with something. Diabetes is an incurable disease, and eye symptoms are too late, and that is why this program and prevention is better than cure. And we recommend primary checkup at the time of diagnosis. A lot of organizations mention that if you are 5-year diabetic, then you can do the eye checkup. But the problem in India is we don't check postprandial sugar or HbA1c every year. And then, you, for example, 3 years you're normal, and the 4th year you find you're mild diabetic. Then you can say you're diabetic that 1 year old and 2 years old. But in India, we have some boil or some surgery or some problem. You do a blood test and you found out sugar is 300 and 400. So the old lesson, prevention is better than cure, is very apt for the ophthalmologist. So primary prevention is the role of primary care physician, and that's where effective screening program for diabetic retinopathy. I'm happy to say I'm working with the Mahim Dharavi Medical Association, the Indian Medical Association. We have National Vice President Dr. Dr. Anil Pachnekar, who's practicing in Dharavi, and he's only the GP who did not close his clinic during COVID, and he was the one who helped the Bombay Municipal Corporation for the COVID to come down. And we are having our own clinic in Dharavi, and we are doing free clinic. And now with the Rotarian Kishore Rajshirke and Rotarian Kishore Masurkar, we are starting diabetic retinopathy free eye screening all the slums of Mumbai. So we want to determine who needs to be referred to an ophthalmologist for close follow-up and possible treatment. The reason we are doing this is diabetic patient, that if they have no vision complaint, does not mean they have eye problem. So that is a problem, and that's where we have introduced this screening through Tele Ophthalmology. And our past president, when he made an Indian Medical Association and AOS, he made the acronym for diabetes. Diabetes invariably affects both eyes. Test your eyes soon, and that's what we want to convey. There are a lot of NGOs and private clinics where go to hospital and get it. So our request is go and get your eyes checked. Wasting money, but I think part time you have to use drops, dilate your eyes, and check. And every citizen deserves an eye checkup. And this is what I want. I'm recommending to our Union Health Minister, Dr. Harshvardhan. I mentioned. So we have done some initiative where I'm happy all over India. We have various hospitals are doing like Arvind, Chitrakot, LV Prasad, the All India Institute of Medical, and there's a community ophthalmology department. So we are using low-cost screening devices at primary eye care centers or in physician clinic. We also have the expensive size. We have the Indian made Trinetra, or we have the that's a Forus, and then also the Remedio camera. And I think the most important is this is our clinic in the Dharavi, which is one of the largest slum in Asia. And you have this is our clinic where patients for diabetic are done free, and the other patients are charged only 30 rupees. In community outreach program we also do the blood test for the blood sugar diabetes. So we go door to door. We have screened about 200,000 slum houses, and we have touched about 8 million people. And these are our social workers who go and test the blood, and also we have data of almost every house. And I think we have a better data than the Google of each house where it is located in Dharavi. And these are screening camps in all the lower middle class and poor area in Mumbai, thanks to Rotary Club of Mumbai Sand, that's my parent club. And we also have published this in the Ophthalmic Epidemiology, the Aditya Diabetic Retinopathy Urban Mumbai Slum Study. And there are several studies called SN Dreams, Shankaranatila Diabetic Retinopathy Evaluation and Management. And L.V. Prasad has done a study, AIMS has done study, and I think and Arvind has got also a study. So this is our camp at Sholapur. That time we screened about 3,000 people, and we have a big team going everywhere. And they also created this again to create awareness on January 26th, 2019. Last year we screened 649 patients in 8 hours, and that means about 45 seconds a patient. We had 15 cameras, and this is a mobile phone attached to a infrared device. And we have trained anybody who I have called a term called ABCD. Anybody can screen for diabetic retinopathy. So this is what we need the NGOs help like Lions, Rotary, or anybody or any donor, philanthropist. We want to create now the government of India has allowed during COVID about 100 people can be assembled as per the government of India notification. So not more than that. So we create a pre-camp awareness, assembly of diabetics, capturing the retinal image, and that's what it will give, which will you can actually screen whether the patient has diabetic retinopathy or not, whether they have a potential for losing vision. And then we can either diagnose with the AI or with the offline AI, or even the doctor can diagnose. And there is a national program for control of blindness by the government of India. They work all over India. There are several cameras. I don't have any financial attachment, any disclosure to make, where we can use smartphone and take retina photographs, and that can be analyzed by the doctors. And you can see a smartphone and a regular phone, fundus camera, and see the comparison almost similar. And they also got approvals for taking photographs. And we are using the first in the world offline AI, which we have published in JAMA Ophthalmology. That was the most read article, where the blue part indicates that the computer will pick up and say the patient has retinopathy, and then they will analyze what type of retinopathy, referable diabetic retinopathy or non-referable. So out of 100, 5 or 10 may be referred to eye doctor. So our idea is to take this to every village in India, and then thereby we can for diabetic retinopathy. So this is the project of using offline AI in prediction of diabetic retinopathy. The sensitivity and specificity is about 100% and 88.4% respectively. We also have done diabetic retinopathy awareness and association with multiple comorbidities as a diamond study with our diabetologist Kiran Shah, and published it. So the summary is early detection And treatment after screening can the prevalence of diabetic retinopathy even in remote areas, and reduction in economic burden among poor and the urban slum people. The idea is if you diagnose early, you have to spend less. That means you don't have to do angiography, you don't have to do laser, don't have to do surgery. And we are also training boys like peons who are 10th pass or fail or school dropouts. We teach them one skill using this mobile phone. Can take photograph, and it will help to improve overall health of the population. So all of us know that the artificial intelligence is the way forward, and this is what is one of the companies have made, saying that in the next 3 decades we will see a technologically disruptive era, and we will both virtually and biologically merge together. And this is offline, and this is the video which you can see the any school dropout can use a smartphone, and you can see take a photograph like this. And if the patients are people are small, and you can use 1% topic drop, which again the healthcare workers can help you. And this is how the patient data can be collected. And there's a software which will say that the photograph image is correct, or it can be taken again. And then it shows you apply it in a offline artificial intelligence, and then it will say referable diabetic retinopathy or a non-referable diabetic retinopathy. And this is our idea of doing the screening, so that without doctors, without technical people, we can train semi-skilled people. And thanks to again Dr. Maipal and Dr. Namrata for signing an MOU with the health sector, the skill development. We have done a session in All India Ophthalmic Society conference in this year in Gurgaon in February 2020. There are several systems. This is a very expensive system, IDX system, which is approved in US, which is about 36 lakhs. Wisconsin has done. Forest has also come out with Tele Ophthalmology software. Google DeepMind has come out, but still they are not able to come in the proper. So the Google AI, if you have seen the Sundar Pichai's video, it says it can predict heart problems by taking pictures of the eye. What it does is it measures the caliber of the blood vessel and then compares with the patients with a heart problem, and then accordingly the AI will predict who can get the heart attack. So the key benefits of that's the future actually. It's not possible today. And the key benefits of artificial intelligence, diabetic retinopathy is a social and economic dimensions. Early detection enables specialists to focus on treatment, so that you don't have to screen 100 patients and then select 5 patients to treat. Deep learning techniques, it has a continuous improvement outcome and relatively low cost and highly scalable process with quick response time. And we want to extend this stop blindness program through Government of India, various state societies, Rotary clubs, Lions Club, Indian Medical Association, Association of Physicians of India, RSSDI. We have Indian College of Physicians where Dr. Shashank is there, and also the International Diabetic Federation, Southeast Asia, where Dr. Shashank Joshi represents. And this was in Netrakum during a thanks to Forest. They sent the camera. Thanks to Professor Kamaljeet, who did send his team to do that, and Manish Tandon took a screen. So this is what I say. Anybody can screen for diabetic retinopathy. And in this picture, you can see normal retina, early diabetic retinopathy changes, late changes, and then finally they lose vision. So why wait till last? And any retinopathy takes minimum 5 years to set in. So if we diagnose early, we'll be happy to treat early. So we have consultants from Center for Sight, from Babu, Lalit Verma, Arvind, Dr. Kim Ramsamy, Dr. Rajiv Raman, from Shankar Netralaya, from Bombay, Dr. Quresh Masketi, Dr. Subudhi, Dr. Partha Bishwas, Dr. Rani Padmaja, Dr. Rajalakshmi from Mohan Vishwanathan, and Dr. Radhika Krishnan from. So we have this AIOS National Committee for Diabetic Retinopathy Awareness and Task Force. And that's the meeting which was held, where we have even the Dr. Pramila Gupta from Government of India, and then we have Dr. Subudhi, Dr. Lalit Verma, all our AOS office bearers, including Ornate India, which is a project from, you can see Dolores, project from the UK. And then I also went and asked help from Verily, which is the offshoot company of the Google. And Dr. Dimitri Azar is an ophthalmologist who was a dean in Chicago and now the CEO of Verily. And this is a team which is working with Sundar Pichai for also with Dr. Kim and Dr. Rajiv Raman for using the diabetic retinopathy. And they are still struggling to come out, but we are happy. We have published our results in the using offline AI, and that's the good for India. That's the AOS to allow stop blindness nationwide via screening. So this is a video which I make. Are you a diabetic, hypertensive? Do you know you may go blind?
The world will forgive you, but will you forgive yourself? Diabetic blindness is preventable. If you're diabetic, you need a retina checkup. Diabetic blind.
So I wanted to say only this part. I'm just reminding that the world will forgive you in case, as an individual, you will go blind because of diabetes. But you are a burden to the family, to yourself, and to the country. And that's why we are making this movement. And then diabetic blindness is preventable. So only preventable when you start diagnosing early, not after you are diagnosed for 2 years or 5 years. And if you are a diabetic, simple thing you have to do is check your retina. So this is what I request through this public forum, to the Rotarians, to the diabetologists, to the physician, to the eye doctors, that if you are a diabetic, you need a retina checkup, and then tell them, put up banners, are you a diabetic and hypertensive? Do you know you may go blind? Because if you have a combination of diabetes and hypertension, and that's a deadly combination. I also thank Dr. Namrata, Dr. Maipal, and Dr. Rajesh, who are the President, Secretary, and Treasurer, for making this movie, where thanks to Alargan, and we have this movie, and thanks to the All India Ophthalmic Society for doing that.
You need a retina checkup to prevent vision loss.
So this is a public service initiative to prevent diabetic retinopathy. Thanks to Rotarian Ramesh Narayan, who was the past president of the Bombay Club, where he helped me to make this. And even now, through the International Advertising Association, I am trying to promote this again. Thank you, Ramesh. I don't know whether you are watching it, but and then we also have a thing in the mobile, which we can see. So this is my 3 generations. We are working to prevent blindness, and we are also, India is the first one to do the cataract surgery in the world by Shushusha, and then later in 17th century. And we have the first eye hospital in Asia, and not even in China, is our government eye hospital, Madras. That's where we 3 generations were trained. And I thank AOS, I thank Indian Medical Association Prevention of Diabetic Blindness Committee, and also Organized Medicine Academic Guild, and specifically Rotary and Blue Cross Laboratory, who make diabetes drugs. And that's a 200-year-old eye hospital in Madras. So I wanted to quote Swami Vivekananda. He says, "They alone live who live for others, and rest are equivalent to death." I had a video where we carry the mobile camera in the motorbike, which we take all over slums and rural parts of. We are also doing a project in Palghar, which is the newest district in Maharashtra, which is about 100 kilometers from Mumbai city, Thana, rural Thana, and Nasik, all this place. So we can carry the place where the van cannot go. We can carry the camera in the in the motorbike. We need a room. We need a semi-skilled worker, a camera. So if any philanthropist can give camera and a salary for a semi-skilled worker, where we are working the healthcare sector skill, we'll be able to screen, because we have 77 million diabetic. If you do daily 100, and every village, we have about 6,47,745 villages, and our Prime Minister is able to address the villages at least once and twice a year through the village panchayat, and we can train them also to screen for diabetic retinopathy. We'll have not only healthy India, we'll have an India with great vision, and I think we have to be a visionary. So I thank for a patient listening, and we are happy to take questions. And can I ask Ashish sir, he's the managing director of